Thanks for those kind words. And I don't use slides. I was forced to provide some, but I usually don't use slides, especially for speaking on headaches, because I think that if you have a head, you'll have a headache. I think about 99% of people in this world have had at least one episode of headache in their life, and the other 1% probably tell lies. So, headache is a complicated stuff, and there are several myths around this headache, and the most important myth is that every headache is something which is a serious condition. The most important thing is that every headache is a serious condition, and one has to be very, very concerned about it, and any headache is basically forebringer of something very serious happening inside your head. The second thing is that every headache requires some sort of CT scan, some sort of MRI, some sort of investigation. And also that the headaches are because of gas which enters into your head. I started headache medicine in India about 25 years ago. And this was a time when I'm not putting any slides. I'm speaking without slides. So what happens is that whenever a patient has a headache, then he goes through what we call as a cycle. The cycle usually would start with an ophthalmologist to get the eyes checked. And then when he'll say that now your refraction is fine, you don't need spectacles, now you go to an ENT surgeon, you'll get your sinuses poked. Then you'll go to an orthopedician, तुम्हारे को cervical हो गया, cervical की वजह से headache हो रहा है. And then finally the person will go to a shrink, to a psychiatrist who would say, first control your tension, then I'll control your headache. Now, actually, headache is a very, very scientific disorder, and there are two types of headache disorders. One is what we call as the primary headaches. The primary headaches are the headaches when headache is the disease. And then you have the secondary headaches where the headache is because of a disease. So a primary headache is like migraine, like tension type headache, like cluster headaches, like trigeminal autonomic kephalalgias, like trigeminal neuralgia. So these are the primary headaches where the disease is that of a headache. While these disorders are very, very severe, they can cause extremely severe pain, but these are disorders which are not serious. On the contrary, the headaches which are secondary is because that there is a disease in that person which is known to cause headache. For example, a ruptured blood vessel inside the brain, intracerebral hemorrhage, a subarachnoid hemorrhage, a tumor inside the brain, glaucoma can cause headaches, sinusitis can cause headaches, cervical spondylosis can cause headaches. Any problem like infections of the brain or infestations of the brain, these all are the secondary disorders which can cause headaches. So it is the primary ones which are very, very common, but it is the secondary ones which are very, very serious. So the idea of approaching a patient with headache is not to make the diagnosis of a primary headache, it is to ensure that a secondary headache is not missed, because those are life-threatening conditions which need to be taken care of on a priority basis. So when we see a patient with headache, we always ask, कब से हो रहा है, कितना हो रहा है, कहाँ पे हो रहा है, what are the factors which are associated with headache, what are the factors which increase your headache, what are the factors which are helpful for your headache. Do you have headache on a daily basis, or do you have headache intermittently? What happens to you when you don't have a headache, and what happens to you when you have a headache? So these things basically tell us that the type of headache which we are dealing with and what are the appropriate measures to take care of such patients. So there are three primary headache disorders which are predominantly important. I would be talking only about two. One was what we call as a migraine, and the second is what we call as a tension type headache. So a migraine headache is an episodic headache which happens intermittently. This headache is preceded by some sort of a depressive episode, a craving for specific types of foods, or a dislike towards all foods, a feeling of being aloof, a feeling of being turned down. After that, about 20% of these patients would have what we call as an aura, and this aura is what we call as a motor, sensory, psychic, or visual phenomenon. Usually it's a visual aura which occurs as a scintillating light or a scintillating spectra in one side of your visual field. It evolves, grows, and then it vanishes. After these patients have headaches, and these headaches are associated with nausea, vomiting, photophobia, which is a dislike towards bright light, and phonophobia, which is a dislike towards loud sounds. So these are the headaches which can last for up to 4 to 72 hours. But the most important thing is that in between these attacks of headaches, the patients are absolutely normal. So these are episodic headaches. In contrast to this, the tension type headaches are the headaches which I call as boss-induced headache. So when you go to the office, headache शुरू होता है, जैसे जैसे बॉस ज़्यादा काम देता है वैसे वैसे हेडेक बढ़ता है, फिर शाम को बॉस घर चला जाता है तो हेडेक भी घर चला जाता है. So this, अरे बंद करो मत यार, लाइट्स खोल दो इसको प्लीज. Sorry? Yeah. So the tension type headache is a heaviness sensation around the head. उसको ऐसा लगता है कि मेरे सर पे किसी ने वजन रख दिया है. I feel that something is tied around my head. किसी ने मेरे सर को जकड़ लिया है. और usually this headache is maximum at around 3 to 5 p.m. जब सबसे ज़्यादा काम होता है, सबसे ज़्यादा टेंशन होती है. And after 5 p.m. when you go home, the headache also goes away. So this is a headache which is occurring on a daily basis. So you can understand the contrast. Migraine and tension type headache. Migraine, which is an episodic severe headache, which is incapacitating, during which the patient cannot perform at all or has to perform inadequately. And the second is a tension type headache, which is a daily headache, increases during the day, and the patient continues to work. Both are primary headaches, and both are very, very common. In India, about 18 to 20% of the general population has migraine, and about 20 to 25% of the general population has tension type headaches. Now, the migraine and the tension type headaches have completely different pathophysiology as to why they are caused. Migraine is something which is related to certain chemical mediators of inflammation inside your brain, which are released in genetically predisposed individuals to certain triggers in the environment. खाना टाइम पे नहीं खाया, हेडेक हो जाएगा. धूप में चले गए बाहर, हेडेक हो जाएगा. कोई टेंशन हो गया, हेडेक हो जाएगा. वाइफ से लड़ाई हो गया, हेडेक हो जाएगा. सास ने ज़्यादा परेशान किया, हेडेक हो जाएगा. कोई स्पेसिफिक टाइप का चीज़ खा लिया, उससे हेडेक हो जाएगा. अजीनोमोटो, बर्गर्स, पिज्ज़ाज, मोज़रेला चीज़, चिली पनीर, black colored foods like lentils, dal makhani, rajma, chole, kale chane, wine, particularly red wine, all those brown colored liquids which we usually consume in the evenings like rum, whiskey, the white colored ones are okay. The white wines are okay. So please keep that in mind. If you are migraine, you think about that. Smoke. In Indian ladies who have large braids, so washing the head and going out with a wet hair in a cold atmosphere can cause headaches. So these are all migraines. So these are triggered in a genetically predisposed individual. And the tension type headache is a headache which is because of tension. So why the headaches happen? In both the cases, while tension type headache is predominantly because of tension, migraine is something which happens or is triggered off by tension. So if you have a more stressful work, then you will have more frequent migraines. But it is not that migraine will be caused only and only by stress. On contrary to this, tension type headache is because of the stress and because of the tension. So there are some types of people, like my wife, they have a tension because there is no tension in life. So that is the most common population of people who have these migraines. So those type A personalities, which say कि toilet में जो towel है वो 3 तह की होनी चाहिए, 4 तह की नहीं होगी. If you have to have socks, they have to be kept only and only in 3 layers and not 1 layer. So if these type of people are there, then they are very, very likely to have migraines. In contrast to me, जो ये कहता है कि यार 9 उंगलियां आती हुई बची हैं, एक ही तो कटी है, चलो 9 से काम चला लेंगे. While other people are the ones कि एक बार सुई में उंगली चुभ गया तो वो कहेंगे सारी दुनिया को दिखाएंगे, मेरे को खून निकल रहा है, मेरे को खून निकल रहा है. So those are the ones who will have headaches, migraines more frequently. But work-related stress is the one which is the cause of the tension type headaches. So now once we have differentiated that these are the headaches, then how do we treat them? So the treatment of both the things, that is the tension type headache and migraine, are completely different. Completely, it's a sea of difference. How much time do I have left? 4 minutes is fine, yeah. So migraine and tension type headaches are treated completely differently. While tension removal is the most important way of treating tension type headaches, migraine is something which is important because it's a severe headache, it's an incapacitating headache. So Ramdev Baba, Anulom Vilom, Kapalbhati, de-stressing yourself, avoiding your stress at work, and treating your work like work, not as a part of your life. So you won't die if you don't work properly, but if you keep on consuming those painkillers on a daily basis, your kidneys and your livers are going to go for a toss. So de-stressing yourself is probably the best way of taking care of the tension type headache. But migraine is a condition which is actually very, very serious in terms of it's not treated properly. The patients would land into what we call as chronic migraine, in which the patients have headaches on more days than not. So the migraine treatment depends upon the frequency of headaches. So if you have 1 or 2 headaches in a month, you don't need any treatment actually. You just identify कि जिस दिन मैंने छोले भटूरे खाए थे, उस दिन मेरे को सर दर्द हुआ था. तो या तो मैं छोले भटूरे छोड़ दूंगा हेडेक से बचने के लिए हैं, या जिस दिन मेरे को छोले भटूरे खाने होंगे एक कैलपॉल या एक डोलो खा के फिर मैं छोले भटूरे खा लूँगा. So if the frequency is very less, identifying the triggers is often the only treatment which you would need, and popping in a painkiller once or twice in a month is absolutely fine. But on contrast to this, if a patient is having headaches 3 or 4 times in a week, then those patients require what we call as prophylactic treatment. So when I see my patients with migraine, I tell them I cannot cure you. जब तक तुम हो तब तक तुम्हारा माइग्रेन तुम्हारे साथ रहेगा, वो तुम्हें छोड़ के कब जाएगा या तो माइग्रेन जानता है या ब्रह्मा जी जानते हैं. So I tell them that your migraine, my job is to make your life comfortable. My job is to make your headache frequencies as less as possible. My job is not to cure you. So if you are having headaches 8 to 10 days in a month and you start having headaches once in a month, my job is done, my target is achieved. So still you will be requiring those painkillers once in a month or twice in a month. But you will need prophylactics on a daily basis. फिर वो कहते हैं डॉक्टर साहब मुझे ट्रीटमेंट कब तक लेना पड़ेगा, तो मैं इनको ये बोलता हूँ कि जैसे गाड़ी में पेट्रोल डालते हैं तब तक गाड़ी चलती है, वैसे ही तुम्हें गोली खानी पड़ेगी तब तक तुम्हारा हेडेक कंट्रोल में रहेगा. So the point is that patients have to be told that there is no course of migraine. Patients आते हैं मेरे पास, डॉक्टर साहब मैंने 6 महीने का कोर्स कर लिया माइग्रेन का, फिर से हेडेक वापस आ गया. तो हेडेक गया ही नहीं था कहीं, वापस कहाँ से आ गया? It was basically under control because you were taking these prophylactics, and once you stop the prophylactics, the headache has to return back. So there are several drugs which can be given for migraine patients. It is a full encyclopedia, and I can speak on all day on just the prophylaxis of migraine. But we choose the medicines depending upon the effect of the person and the side effect profile of the drug. So if there is a lean, thin patient who is very depressed, I would like to give him amitriptyline because amitriptyline ka side effect hota hai weight gain. And it also causes a significant improvement in your depression. On the contrary, I would not give a beta blocker, particularly propranolol, to a young male because it causes erectile dysfunction. I will not give a drug called as topiramate to a child because it causes learning disability. My choice for migraine in a child might be flunarizine or maybe cyproheptadine, which increases your appetite. तो उसमें बच्चे का भी headache ठीक हो जाता है और बच्चा ढंग से खाने लगता है तो मम्मी का भी headache ठीक हो जाता है. And there are several other drugs. And, over a period of time, new drugs have come into the horizons, which are called as anti-CGRP molecules. So these anti-CGRP molecules are in the form of an injection, which is to be given once in a month. So we are there in the field of headache medicine now, where initially when only a few medicines were available, we have one injection which is to be once in a month, and sometimes even once in 3 months, which will take care of a significant part of your migraine and will control your frequency of headaches significantly. Now, the point is for these patients, it is not only the treatment which is important, it is also important to explain to them about their disease, and of course try to tell them about identifying their triggers and avoiding them as far as possible. But this is not always done. Most people treat headache as a stepson or a stepdaughter. Even the neurologists think कि सर दर्द वाला मरीज आया ये मेरे को भी सर दर्द देगा. But actually, only those people who are suffering from migraines understand the problem and the severity and how badly their quality of life is impaired because of these headaches. I have had a patient, a doctor, who was actually a national level badminton player. And he mismanaged his migraine to an extent that he used to inject himself with the Fortwin and Finargan almost twice a day. He used to consume 20 to 30 painkillers every single day without fail. And this guy did not have a single vein which was patent in his body when he came to me for his treatment. So his kidneys had gone for a toss, his creatinine was shooting up, he was hypertensive, he had hepatotoxicity because of the drugs. So these are those patients which we call as chronic migraineurs, in which the headache is more than 15 days in a month. Now for these patients, there is a treatment which we call as botulinum toxin injection. So Botox is not only used for beautifying ladies, it is now also used for migraine. And this is given at around 31 points across the skull. I initiated this treatment for the first time in India in 2002 and probably have the maximum experience in the country about Botox and migraine. But it is not that you give migraine Botox to every patient who comes to you with the chronic migraine. It is only in those patients where practically nothing else works. So de-stressing yourself is an important thing. Your workplace management and your work stress is an important thing. Your life is not related to your work. Your life is not your work. Because we all know that famous saying that yesterday is history, tomorrow is a mystery, today is a gift, and that's why you call it as present. Thank you very much for your kind attention.
So I have a question for you before anybody else does. You talk, and the topic we're discussing it is psychosocial environment. So, in your experience, do you see migraines more happening in the city life as compared to village life? And what are the triggering factors that are absent in the village life that help?
You don't have McDonald's. Sorry? You don't have McDonald's. You don't have Facebook. You don't have Twitter. You don't have Insta. You don't have a significant amount of exposure to television. You don't have these evenings with loud music. You have a disciplined life. You go into the fields, you work into your fields, you go early home, you sleep early in time and get up in time. Now, these are all those things which we actually tell the people to intercalcate in their daily living, but they don't. So, and these are, unfortunately, the most important triggers for migraine.
Sir, what is the role of using so many electronic gadgets these days which probably compound the intensity of the headache?
Oh yes, it is absolutely. There are several studies which have shown that any screen time of more than 2 hours is associated with about a 20% increase in migraines and tension type headaches. In COVID, we saw a humongous amount of increase in the frequency of headaches because everybody was Zooming. The only thing was, am I visible? Am I audible? And that was everything which was happening on Zoom. So at that time, the migraine frequency was so high. All my online consultations were because, मेरा migraine बिगड़ गया, मेरे को सर दर्द बहुत ज़्यादा परेशान कर रहा है. Everybody was working from home, so yes.
And probably it adds to visual disturbance also, which further adds to...
Absolutely.
Sir, you have research on food and reversal or management. So you said you can't reverse it, but to manage migraine.
No. No, migraine is actually a genetic disease. So if you have about a 20% positivity of family history in patients with migraine, so you cannot take the genes out of your body. But yes, by managing your triggers, of which about 40 to 50% are very easily manageable. Eating in time does not cost anything. Sleeping in time does not cost anything. If you want to go out in the sun using a dark colored glass and an umbrella and walking in the sun doesn't cause anything. Avoiding your stress doesn't cause anything. Yoga does not cause anything. And if you can identify your foods, that this is the one which definitely will cause headache to me, then you have two options. Be ready to have headache on the day you consume that food or avoid that food. Simple. So,
considering the last 10 years, how life has changed, migraine demographics have changed. As you said, it's genetics. But is it happening in the lower age groups like teens, 13, 14?
yes, migraine can occur in people as low as 6 years. The type of migraine which happens in children is completely different. It is not sometimes that you will have a headache. Sometimes these people have only abdominal colics, abdominal pain. Sometimes they would complain of only spinning sensation. The child would suddenly leave playing, would come, sit into the lap of the mother, and then after 45-50 minutes, he will improve and go away. It is also associated with the, unconsciousness. Can you imagine that migraine can cause unconsciousness in children? So any age is there. But yes, the frequency of age-specific migraine is increasing with time. Very significantly increasing with time. And it is absolutely based on lifestyle and nothing else. Because the genetics has remained the same. The triggering factors have tripled.